online at DeVry University with 50% tuition savings and a waived application fee. Don't miss this incredible opportunity. Restrictions apply. Visit partner.devry.edu/Caribbean today.
Unlock the secrets to a healthier you. Join Dr. Natalie Osborne every Tuesday at 8:30 a.m. on WinFM 98.9 for Weekly Dose. During this 30-minute health discussion, we aim to educate and empower our listeners on the prevention of diseases, early diagnosis, and timely intervention. Don't miss out on this informative health talk where we teach you to live your best life. Weekly Dose, Tuesdays on WinFM 98.9.
Welcome to Island Tea with your faves. Keep it locked in with us for your daily dose of hot tea, only on Win Media 98.9.
And we are back on Island Tea, and as I mentioned at the top of the hour, it is time for Weekly Dose with Dr. Natalie Osborne. And I mentioned the topic, common stomach issues. Doc, good morning. How are you? Welcome back.
Good morning, Hortensia. It's great to be back with you. And I must mention that this month would make 2 years I've been doing this show on a regular basis every Tuesday morning.
Yeah, you've been steadfast.
One of the things that our listeners will have to appreciate that we bring this information to educate, because knowledge is power, and I hope that they've taken the time to listen and use some of this information to empower themselves. It's not to stop you or deter you or take the place of your physician, but to empower yourself when you seek medical attention, knowing what are the right questions to ask, knowing how to express yourselves in terms of what symptoms you're having. And so persons who are listening us do not realize the amount of effort and work we put in to bring this show and making sure, doing the necessary research and bringing topics that we hope that the audience can benefit and learn from. So today, so that was just to remind everybody, this month is my second year doing the show consistently. So today we're going to be talking about stomach issues. Why this topic? Because in my practice, I see a lot of patients who talk about and having abdominal complaint and stomach issues, and everything in their belly they call the stomach, for example. And I would tell you a brief story that happened last year. There was a lady who was 64 years plus, thereabout in her 60s. She presented to me with weight loss, abdominal pain, feeling full very early, and having intermittent vomits. This was a patient who was also diabetic. And so she had almost a year back and forth with some of these symptoms. And at first, some of these discomfort was so vague, she kind of dismissed it. Because oftentimes we say, oh, we have this funny feeling, and then it goes away, because some of these symptoms can be very vague. Ultimately, she had an upper endoscopy and biopsy because there was a tumor found, and the patient was diagnosed with gastric cancer. She went on to have some chemotherapy treatment. She had surgery, but eventually she succumbed to this disease, because this disease can be diagnosed pretty late and can be very aggressive. So we're going to talk about some of the stuff that affects the stomach, some of the common issues.
Before we go on, I know somebody heard that and probably has the same question. When you said the disease can be detected very late, is it that the patient, and not specifically talking about the patient you mentioned, but is it that the patient presented himself too late, or is that it takes a while to diagnose that type of cancer?
Well, it can be a combination of both, but mostly because of the type of cancer that it is, the symptoms in the initial state, and we'll talk about that when we touch on gastric cancer. As one of the stomach issues is that these symptoms present very vaguely, and some of the common stomach issues, the symptoms are the same. So as we said, you can ignore it or postpone it, and they can be so vague. By the time you start having these more pronounced symptoms, then it might be pretty advanced. So that is one of the cancers that can have late presentation. Another cancer, just to mention it, is pancreatic cancer. That is why it has one of the poorest outcome as well too, because by the time it is diagnosed, it's a cancer that has advanced so much.
Rapidly.
Okay?
Okay. Oh boy. So let us first find out, what is the stomach?
Yeah, because everybody calls everything in your tummy stomach. Oh, my stomach is hurting, but they're pointing just over their pelvic region. But the stomach is nothing more than an organ. It's like a sac-shaped organ that is a part of the gastrointestinal tract, one of the most important organ there. So we start with the food in the mouth, cartensia, then it gets down that pipe.
Yep.
You often hear us talk about it. That pipe is called the esophagus. So it takes the food into the stomach.
Excuse me.
And that stomach there is responsible for doing a lot of work. It's a muscular structure, and it's very important in the digestive, in digesting and breaking down a lot of these food. So it's a special, specific organ. So it's not fear just to say everything that hurts in the tummy is the stomach.
What about the function of the stomach?
Yes, I'm glad that you asked that. The function of the stomach are very important. So digestion kind of starts in the mouth, and it does, with the breakdown of some of these carbohydrates or starch by the saliva. We have things that we call enzymes, and they are part of breaking it down. Think about the little bichos or little things that come and break down the food. So by the time it gets to the stomach, there are other enzymes in the stomach that are very important that breaks down protein. So when you have a nice steak, there are lots of enzymes there, and it further breaks down the starch. So if you have potatoes, that's important there. And so it produces acids. Lots of acids, hydrochloric acid is produced in the stomach, and all of these are produced from little cells that line the stomach. And the stomach does that, and it churns up the food, and we call that chyme. Okay, and it makes it into a liquid paste, and then that liquid paste passes through an opening and get into the small intestines. So in summary, the functions of the stomach is to break down the food. It's like a storage sac, because it is very muscular, and it has the ability to dilate significantly. You know, sometimes we have a big meal, the stomach can dilate significantly, so it can store the food there for a while, break it down, and help it pass into the small intestines.
Okay, so let us talk about some of the common stomach conditions.
Yes, so I'm going to mention them, and then we'll discuss them a little bit more in detail. So you heard about this famous gastric reflux or reflux disease, many persons. So it's called gastroesophageal reflux disease. The name says it. So it comes back from the stomach, back into the esophagus. Okay, so your content should be going down and progressing forward. It shouldn't be retrograde. It shouldn't be going backwards. So that can happen. And there are things like peptic ulcer disease, which is another common condition, gastritis. Remember, we taught our audience, once you heard itis, you know it's some kind of infectious or inflammatory process. We have things like gastric cancer. We've got viral gastroenteritis, another infectious process. We have something that's called hiatal hernia. There are other conditions, but these are the most common that we come across in our day-to-day community.
Let me ask a question, if I may. We see often in young children worms in the stomach. Is it that worms are in everyone's stomach? Is it only when people are young they have it?
Okay, so yet again we have to refocus. A good question, but when he's saying stomach, he's talking about everything on the inside again. Worms are really going to be in the stomach, especially in our communities. There's some very third world country where you can have severe parasites and stuff, but it's not very common because the stomach itself, the acid is not conducive to the survival of a lot of these. You could have worms in other parts of the GI tract or the intestine, the large colon. It happens to children. They come in contact with the dirt and they put their fingers in their mouth and they get these cysts or ovaries of the parasites, and then they develop inside the GI tract and they inhabit that part of the GI tract, and then they have the itching in the bottom, the abdominal discomfort and stuff. But that is not common inside of the stomach itself. Okay?
Okay. What is gastroesophageal reflux disease?
So let's break that down. It's reflux disease. So keep that in mind. And several persons come presenting with that. So we said that the food goes down the food pipe or the esophagus. Acids inside of the stomach, they can be very harsh, but the stomach has a very well-designed lining to protect itself from this acid. But what happened, the acid is very aggressive to the esophagus. So what happens, if there is a problem there and any weakness there in the closure, because there should be a sphincter or closure from the esophagus into the stomach. So when the food is inside of the stomach, around, it shouldn't go back up into the esophagus. If there is any defect or weakness there, content from the stomach can flow back into esophagus, giving you that discomfort, of course, and giving you what we call heartburn, because it irritates the lining of the esophagus. Remember, that's the food pipe, and that is not designed to take in a lot of these acidic content. So persons are at risk if they are obese. Why obesity? Is not that we're picking on obesity, is that there's much more visceral fat surrounding your organs, putting much more pressure on it, and can create that problems. People who smoke, people who are pregnant, our ladies when they're pregnant, remember the fetus is growing in the uterus and it pushes all of the organs aside. So it is compressing the stomach. The stomach cannot hold as much as it held before, and so a lot of the content can easily push back up into the esophagus.
That's why they vomit so much.
People who are diabetic, people who have different health conditions like the same hiatal hernia. So the treatment for this is typically going to be over-the-counter medications and dietary changes. One of the things that persons need to do, if you have a diet that is high in fat and greasy stuff that can irritate and create problems, you want to have smaller meals. So a lot of the times it's going to come down to dietary changes and be much more disciplined. Some persons may require some over-the-counter medication as well. Some persons may have to raise their head on several pillows at night so that they can be much more comfortable. You want to ensure also that when you eat a meal, you do not go to lie down. Think about like you have a bottle, Cartensia. And if you put that bottle upwards, vertical, the content is down, and you put it on the side, it flows backward. And we do not want that. So we encourage our people to make sure after a big meal, after any meal, you should sit up for at least 45 to an hour. But we love to go on the bed because you've had a tough day and you just want to lie down.
Why is it that this thing is referred to as heartburn as opposed to chest burn?
It's just because it's just what the name is. And historically, there are lots of similarities, and we can have differentials between the chest, anything that's going on in the chest, and the esophagus is inside the chest. So it has gotten the name heartburn, heartburn, but nothing, and I like that you said that it has nothing at all to do with your heart. It is separate and distinct. But because you have that burning irritation sensation, and it comes up, and you sometimes taste that bitterness in your mouth. Yes, but it has nothing to do with the heart.
Okay, let's talk about gastritis. What is it?
Our audience know gastritis to the T now. The stomach is gastric or anything from the stomach, and itis is inflammation or infection. So it can happen quite frequently. It says that about, in the United States, 8 in 1,000 persons have acute gastritis, and if not dealt with adequately, it can go on to become chronic. So these persons can have hiccups, nausea, vomiting, they feel bloated, they lose their appetite. And if it becomes so severe because there's some bleeding in the stomach, you can have black stools. What happens when you have gastritis? It is as a result most times some of the risk consuming alcohol because it can irritate the stomach. And in the stomach, what you're going to have, small breaks in the lining, like superficial breaks, okay? And irritation of the lining and inflammation there. And so things like using certain medications, a lot of time we rush to these NSAIDs. We talk about them all the time, ibuprofen or Motrin. You can buy them over the counter.
Yep.
You can grab some Voltaren, and those can create problems inside of the stomach and irritate. It can be as a result of pernicious anemia. That's anemia associated with vitamin B12 deficiency. It can be associated with things like infection, like viral or bacterial. Okay, and so a lot of the times it's associated with things that we commonly use, like the NSAIDs. The persons who are heavy smokers, they had increased risk of having that. Commonly, you want to treat it similar like you treat the reflux disease. You can use antacids, sometimes over the counter, and that can settle off. You have to watch your diet with that period. Sometimes dietary changes is important. It's not, we're not saying it's permanent, but you want to cut down on those greasy stuff, chocolate, acidic foods that can irritate the stomach further. And we can give you things that can decrease the amount of secretion of the gastric juices in the stomach, because these juices or acids are produced by little tiny cells inside of the stomach, and the medication would decrease the quantity so that the stomach lining is exposed to less acid and it can have a chance to heal.
Alrighty, let's talk about a peptic ulcer. Peptic ulcer disease. Wow. So what is that?
So peptic ulcer disease, it's all follow-up to this gastritis. Once you hear peptic ulcer disease, it's talking about an ulcer or sore. So keep that in mind. You've seen persons with sore on their skins or ulcers. It's the same thing inside of the stomach or inside of the duodenum. The duodenum is the first part of the small intestine once you leave the stomach. So you can have an ulcer in either of these two spots. So it's nothing more than erosion of the lining of the stomach or the duodenum that leads to this irritation because of some of the same things we mentioned. Persons who are at risk are persons who use a lot of NSAIDs, drugs. One of the most common causes of this peptic ulcer disease is a bacteria called H. pylori. Lots of persons would have heard about it. They're being tested for it. Studies show that about 50% of us may have the bacteria living in our stomach, but not all of us would have it affect us. Okay, there can be overgrowth of the bacteria, but that a bacteria secretes certain substance that can destroy the lining of the stomach, and then you have this ulcer. It can start very superficial, and just like an ulcer on the foot, you would have seen that, and it can erode over time and create lots of problems, like that severe burning in the stomach. You can have blackened stool if it is bleeding. You could have that acid sensation there. You could have nausea. You could have vomits. You could have chest pain. Yet again, the problem is not associated with the heart. And so these things can become very serious if not dealt with, because as a result of having a peptic ulcer disease, you can have things like severe bleeding. And so persons are presented to us with ulcers, and their hemoglobin or blood count go down very low because it's bleeding like a pipe, dripping, and you do not notice until you start to feel weak, you start to feel lethargic, fatigue, and we check your blood count and see that it's low. Okay, so I want to keep those things in mind. What you want to do in terms of taking care of this, of course, dietary changes. And because most of the time it's caused by a bacteria, we could introduce treatment with antibiotics, okay, and proton pump inhibitors. You've heard of things like omeprazole, pantoprazole. You heard a lot of those. Your doctors will give you things like that. So you got to make sure that ulcer or that sore heals without any complication, because one of the most severe complications, though rare, is that it can erode right through the wall of the stomach, leading to a perforation. And we've had a couple patients who present with that, but it is not the most common. Okay, let us talk about viral gastroenteritis.
gastroenteritis?
I think a couple weeks ago we mentioned that because we were talking about abdominal conditions in children. I don't remember that, Hortensia. So any kind of virus can get into the stomach and create havoc. It can be seasonal. It can be in conditions where there's a lot of cluster in schools, in dormitory places like that. And so it's viral. This is a condition that typically is benign. And within a couple of days, the person starts to feel better. They can have, though, abdominal cramping, bloating, that sensation of discomfort. They can have vomits. But most of the time, it resolves on its own spontaneously, and persons go on to do quite well. So, but these are some of the conditions. That's another condition that can affect the stomach.
Okay, let's talk about the hiatal hernia.
So lots of persons are going to their doctors, they have endoscopies, and they're told that they have a hiatal hernia. So a hiatal hernia is the stomach is separated from the chest, right? So the belly is separated from the chest by this big muscle. We call that the diaphragm. And there are different openings to allow different structures to pass through. So the esophagus passes through the diaphragm, and then it becomes the stomach there, okay? What happens if there's a weakness in the wall, sometimes we don't know why, of the diaphragm, part of the stomach can push up into the chest. In various degrees, because it can be graded from grade 1 to around grade 4. So grade 1 to grade 4. It depends on the degree in which the stomach pushes up into the chest. Are you with me?
You have a caller if you want to.
Yes, go right ahead. Let's take the call.
Caller, good morning. You're live on Weekly Dose.
Hi, good morning.
Hello?
We lost the
Caller, you can call back. The call dropped.
Try again. Try again. You.
Caller, you're live on Weekly Dose. Good morning.
Yeah, good morning. I really like the topic this morning because I'm glad the doctor touched. I had that experience. I bought some Chinese food, and immediately after, I was in the toilet. And I couldn't understand what was going on. I was losing weight, and I told my family members, but they were ignoring me because I'm a worrywart. So they thought I was just worrying. You know what? It turns out I had that there, H. pylori. And as a matter of fact, I had to do an endoscopy, and I did it on my birthday because I was so curious. I really wanted to know what was going on. I had a lot of belly ache, and easily I got to work, and I had to leave. It was that bad. So, and I didn't know, and the doctor told me it was H. pylori and something with some. She just mentioned something about a hiatal hernia. I had gastritis. I had everything. I was losing weight. I just thought it was the big deal. When I told my sister at home, she said, "Granette, stop worry. Because I didn't know what was wrong. And so I kind of glad you touched that topic. When I Googled it, it's the things like a caterpillar. I said, this is what's living in the stomach. So when people sick, you really got to check the doctor, you hear? You really got to check out this. The anesthesia, the ladies who they had given me a kind of thing to put me for myself. And she was like, when she asked me my birthday, she said, you come? I said, yeah, because if I'm healthy, I ain't going to live to see another birthday. I actually did the endoscopy on my birthday. Can you imagine that?
Yeah. Well, I'm glad you're doing so much better.
Yeah. Okay, I'm doing good now, though.
Okay, thank you.
Thank you for your contribution. A caterpillar?
No, I think she's saying she Googled it, and the when the bacteria has some like tentacles at the bottom of it when you look at
so
it under the microscope.
Okay,
Yeah,
okay.
So that's why she spoke
Okay.
about that. I
Okay.
like the fact that she brought up the hiatal hernia because a lot of these issues, as we're talking about the hiatal hernia, can have similar complaints, and sometimes they go hand in hand. Because why I say that, the hiatal hernia, because part of the stomach pushes up into the chest cavity, it can give you that same reflux disease. So it could be as a result of that. And the symptoms are quite similar, where you have the heartburn, the abdominal pain, the abdominal discomfort, okay? And so these are similar. So when would we confirm, or how can we confirm that you have a hiatal hernia? Is with an endoscopy. Of
So
course,
you
you see the
must.
change. You see the changes. I want to let our audience know as well, though it's a benign condition for most parts. Most of our advice to the patient is going to be dietary changes. And I mentioned that with the reflux disease, smaller, more frequent meals. You may have to, for a time, because of the irritation, decrease the foods that are rich in acids, like your tomato pastes, tomato salts, the juices from the grapefruit, the pineapple, and those things that can irritate the stomach. And you want to ensure that after meals you sit upright. I can't emphasize that enough. And let your stomach and let the content digest properly, and then pass through from the stomach into the small intestine. Going to lie down after a big meal, after any meal, is not what is best for our patients. Okay?
Even if you put 5 pillows under your head.
Well, you want to sit in the lazy boy, or you want to sit almost upright, sit on your chair, watch your TV, do something until your food kind of settles down better. So we don't have that.
For the second time this morning, I heard you use the word malignant. I remember as a young kid growing up, I saw a program, sitcom, I think it was, General Hospital, and I heard malignant and benign. So could you explain the difference between?
Okay, so hiatal hernia is a benign condition, okay, just to reemphasize that if anybody misunderstood me. Most of the times it is treated with dietary changes and general advice, which I just mentioned. When we talk about benign and malignant condition, benign means that it is not cancerous. So when a condition is benign, there are no cancer changes.
I made the
or
mistake.
cancer cells.
You didn't use the word benign. You said malignant, I think.
Okay, so I'm explaining both. And malignant means that anything that there's an abnormal tumoral growth there. Okay? And once you have, because people misunderstand the word tumor, because a tumor can be benign or malignant. The difference is a benign tumor is limited. A malignant tumor is then going to multiply fast and spread, to make it simple, to distant organs and create havoc. Okay? But tumors can be benign or malignant. So when we talk about malignant, we're talking about the bad stuff that there's like there's a cancer there. Okay? So that's the difference.
Alrighty. So let's talk about gastroparesis.
So gastroparesis, that's another stomach issue that happens quite frequently. It is nothing more than inside our GI tract, there is waves, peristaltic waves that pushes things along, okay? And what happened, there's changes in the nerve system of the stomach. And what happened, it doesn't push the food content. So a lot of the content settles in the stomach, and the stomach is a muscle, and it can become very dilated. So this individual has stasis. So the content inside the stomach persists or is delayed because what? The muscles are not contracting enough and pushing the food as it should go along. And so that could lead to things like abdominal pain, bloating, vomit, all that discomfort, even that acidic sensation because the food is sitting in your stomach, and it can have backflow and give you that bitter taste in your mouth. And it's seen oftentimes in patients who are diabetic. Why? We've spoken a lot about diabetes as well, because with diabetes, the nerves are damaged over time, and nerves are everywhere. So the diabetes can affect the nerves in the stomach, weakening the ability for the stomach to contract and do its work. So there is stasis there. And it can be seen in other persons as well, persons who would have had surgery. Sometimes post-surgery, we know that a person may have some dysfunction for a bit of time based on certain drugs that we use, okay? And then the stimulation gets back and it starts functioning. So there are different conditions like that, all right?
At the top of the show, we started with cancer. So let's talk about the stomach cancer now.
Okay, the stomach cancer, that's the most feared. And that's something that we want to make sure in our society we decrease the late diagnosis, okay? Stomach cancer is the fourth most common gastrointestinal cancer, all right? It is not very common, but we have seen increasing in gastric cancers over the years. And in the last 2 years, we've had patients that were in their 30s with gastric cancer. There are lots of risk factors associated with it. So that is a malignancy. So it typically starts in the lining of the stomach. And so what happens? There is mutation or changes. Remember, cells are supposed to be born and die. That's the normal course of life, the same way we all are going to do. But what happens? These cells persist and they start to multiply and they create these tumors. And if not identified early, all these tumors progress and advance, and then it can become an advanced stage tumor. So one of the things we talk about at the top of the discussion was that these tumors can be difficult to diagnose, because in an early case of gastric cancer, Hortensia, is that the symptoms are so vague, and the symptoms are quite similar to all of the different diseases that we've mentioned. You have the abdominal bloating, you just feel a little bit uncomfortable, you're going to say, in the stomach. You don't want to eat as much. You feel like you get fuller earlier, but you just kind of think it because it's so non-specific. You start losing weight, and you say maybe, oh, it's my diabetes, because if you have diabetes or some underlying condition, oh, because I'm not eating, and then eventually these symptoms can become worse with significant weight loss, vomiting, unable to hold anything down, passing black tarry stool, okay, feeling fatigue, your blood count drop off, and sometimes that's when you finally present. And then we make a diagnosis via the endoscopy and biopsy, taking tissue samples and letting the pathologist look at it, and then we make a diagnosis of gastric cancer. The thing that is different from colorectal cancer, which is the number one gastrointestinal cancer, is that though there is no screening per se designed in our community for stomach cancer. It's not that we're saying, and it's not established that at age 40 or age 50 everybody must have an endoscopy. We know that the standard is age 45 to start having your screening colonoscopy, but there's no such thing established
For the stomach.
because stomach cancer, although it is increasing, it's still very rare. So protocols and standards going to have to be enforced and established over time. So there are persons who are more at risk, male as opposed to female, Hortensia. So the males get a little bit more than us. Persons who have genetic malformations or genetic changes, there are quite a lot of them. Persons who have chronic gastritis or atrophic gastritis. Persons who are advancing age, more commonly when they get in the 60s and 70s. Those are risk factors. And lots of these things are come down to genetic changes at a cellular level, and we have no control. But smoking also plays a risk factor, so we want to stop smoking. Alcohol excess plays a risk factor. We want to decrease our alcohol consumption. So these are certain lifestyle changes. Persons who are obese. You realize a recurring theme in everything that we speak about?
Everything.
Obesity, smoking, alcohol. There's certain things that that we can control. And smoked foods, because studies show that persons of that Asian descendants, like the Japanese, they do much more aggressive screening for gastric cancer because it's seen much more in their population. Like the cured meats, that salted meats, those smoked meats, there's association with that and the increased risk of developing gastric cancer.
You know, it amazes me how you doctors can keep abreast of all those words and terms and, you know, big words.
It takes special people to be doctors. It really does.
And it takes time,
Yeah.
just like anybody. If you're an accountant, you've got your accountant skills that, you know, that comes second nature after a while. And it is very important. I like you brought that up, because doctors, we've got to emphasize and make sure we're abreast of the not just the latest, but the most common conditions. I've always said it doesn't make sense focusing on the weird and wonderful, but we miss the colon cancer, or we miss the common conditions that patients are going to present with. That is why we do these presentations, so we can discuss some of the most common diseases or conditions and the symptoms and how they present, to encourage our people to get themselves checked, follow up with their physicians.
Well, Doc, you know it's always a pleasure for me. I know I make the faces, but it's like, oh my gosh, inside of me it's just bubbling up. It's always a pleasure. I know for the audience, it's always a pleasure learning and listening to the doc, and thank you for your contribution, caller. It was accepted with grace, and I'm sure somebody else that was listening out there can, let's not say self-diagnose, but say, okay, let me go to the doctor and explain these symptoms that I'm having.
Explain the symptoms.
So any closing words, Dr. Osborne, before we close the segment today?
I always want to wish everybody a beautiful day. We have been having a lot of lives lost and a lot of disruption in our community, so we have to be just kind and patient and a little bit more tolerant with each other. Okay, so we have to learn to love on each other a little bit more. That would be my parting words, to be positive. So I wish everybody a beautiful day.
Alrighty. Thank you, Dr. Osborne, and to the audience. This is where I take my leave, but don't forget Quint is here. See you. I'll be in tomorrow and Friday. I won't be in on Thursday. So thank you for listening. Have a great Tuesday. And as the doc said, let's all be kind and patient towards each other. We'll make the world a little better.
WINN is 98.9. 98.9 is Win FM.
If you live in low-lying areas, be aware of the possibility of tsunamis immediately after an earthquake. A strong earthquake lasting 20 seconds or more is a natural